Good afternoon, everyone. Today, we're going to delve into a pervasive health concern that affects millions worldwide: hearing loss. This isn't just about struggling to hear, it significantly impacts our quality of life, our ability to communicate effectively, and can even affect cognitive health. While often associated with aging, hearing loss can stem from a surprisingly diverse array of causes, some treatable, and others requiring long-term management. Our goal today is to provide a comprehensive understanding of its causes, how it progresses, the available treatments, and, critically, the proactive steps we can take to protect our hearing. Let's start with a cause of hearing loss that's sometimes overlooked: ototoxicity. This term refers to when certain medications damage the delicate structures of the inner ear. While many drug classes can be ototoxic, our focus today will be on hypertension medications, commonly known as blood pressure drugs. It's crucial to be aware that even common medications can have this hidden impact. Among hypertension treatments, loop diuretics, like furosemide and bumetanide, are the most commonly implicated. These water pills work by interfering with the stria vascularis, a crucial structure within the cochlea, our spiral-shaped organ of hearing. This disruption can temporarily decrease the electrical potential essential for our hair cells to function, leading to hearing loss and tinnitus, which is ringing or buzzing in the ears. The good news is that hearing loss from loop diuretics is often temporary and reversible, especially with lower doses or discontinuation. However, it's important to know that with high intravenous doses, rapid administration, or in individuals with pre-existing kidney impairment, permanent damage can occur in rare cases. While less common, other hypertension medications like ACE inhibitors, beta blockers, and calcium channel blockers have also been rarely associated with tinnitus or hearing loss. Their exact mechanisms are less understood but may involve effects on blood flow to the inner ear or subtle alterations in neural pathways. A key characteristic of medication-induced hearing loss is that it's almost universally bilateral, meaning it affects both ears simultaneously, as the drugs circulate throughout the bloodstream. While the degree of loss might be slightly asymmetrical, both ears are typically impacted. This type of hearing loss characteristically begins with the high frequencies. This is due to the tonotopic organization of the cochlea, where the base, responsible for high frequencies, is often more vulnerable to damage. Let's look at the progression. In the initial stage, patients experience high-frequency loss. They might hear sounds but struggle significantly to distinguish words, particularly high-pitched consonant sounds like S or F. This often manifests as, "I can hear noises, but people sound like they're mumbling." Tinnitus is a very common companion symptom at this stage and often an earlier warning sign than noticeable hearing loss. In the intermediate stage, if exposure continues, the damage spreads, affecting the mid-range frequencies crucial for overall speech understanding. Sounds might start to feel generally muffled, and understanding conversations becomes consistently harder, even in quieter settings. This increased listening effort can lead to significant fatigue. In the advanced stage, in severe and prolonged cases, the damage spreads to the entire cochlea, including the low frequencies. At this point, the patient will experience significant difficulty hearing most sounds, not just speech. Sounds become very quiet and indistinct, and communication without significant amplification or visual cues, like lip reading, becomes extremely difficult. Now, a critical point for suspected medication-induced hearing loss: do not stop your medication immediately. Especially for vital drugs like hypertension treatments, abrupt cessation can lead to severe health crises. Always consult your prescribing doctor first. So, what are the next steps if you suspect medication-induced hearing loss? Contact your prescribing doctor immediately. Inform them of your symptoms, being specific about when you notice them and any changes in dosage or new medications. Your doctor needs to assess the situation and weigh the risks and benefits. You should then expect an audiology referral for a comprehensive hearing evaluation. This is essential to confirm the hearing loss, determine its type and degree, and establish a baseline or track changes. High-frequency testing is crucial here, and for high-risk medications, ototoxicity monitoring with regular hearing tests may be implemented. Based on these findings, you'll discuss medication adjustments with your doctor, which could include dosage reduction, switching to less ototoxic medications, or continued strict monitoring. Beyond medication, hearing loss isn't a single condition. Its causes are diverse and categorized by the part of the ear affected. We have three main types: conductive hearing loss, which occurs when sound waves cannot efficiently reach the inner ear due to problems in the outer or middle ear. Then there's sensorineural hearing loss, or SNHL, which involves damage to the inner ear itself or the auditory nerve. And finally, mixed hearing loss, which is, as the name suggests, a combination of both conductive and sensorineural components. Let's look closer at conductive hearing loss. This occurs when sound waves cannot efficiently reach the inner ear due to problems in the outer or middle ear. It often results in muffled or quieter sounds and is frequently unilateral, affecting one ear, or asymmetrical bilateral, meaning one ear is worse than the other. Common culprits include earwax impaction, which is the most frequent and easily treatable cause, ear infections, a perforated eardrum, otosclerosis, or even things like eustachian tube dysfunction. Moving on to sensorineural hearing loss, or SNHL, this involves damage to the inner ear, specifically the cochlea and its hair cells, or the auditory nerve. This type is often permanent. The most common cause is aging, or presbycusis, a gradual, natural degeneration that's almost always bilateral and symmetrical. Noise exposure, whether from an acute acoustic trauma or chronic exposure from loud music or occupational noise, is another major culprit. We also have sudden sensorineural hearing loss, SSNHL, which is an unexplained, rapid loss that's considered a medical emergency, usually affecting one ear. Other significant causes include genetics, various infections like mumps or meningitis, and head trauma or injury. Beyond those more common causes, there are other important contributors to SNHL. Meniere's disease is an inner ear disorder that often starts unilaterally but can become bilateral in many cases. Autoimmune inner ear disease, AIED, is a rare condition where the body's immune system attacks the inner ear, usually affecting both ears. Circulatory problems or vascular diseases, such as high blood pressure or diabetes, can impair the delicate blood supply to the inner ear. Tumors, specifically an acoustic neuroma, are benign growths on the auditory nerve that characteristically cause progressive unilateral hearing loss. Lastly, certain neurological conditions like multiple sclerosis can affect auditory pathways. To pinpoint the cause of hearing loss, healthcare professionals employ a systematic and collaborative approach, starting with an initial assessment. This begins with a detailed medical history. Your doctor will gather crucial clues about the onset of your hearing loss, whether it's in one or both ears, how it's progressed, and any associated symptoms like tinnitus or dizziness. They'll also ask about your past ear issues, general health conditions, current and past medications, especially important for identifying ototoxic drugs, family history, and noise exposure. This is followed by a physical examination, where an EN specialist or your primary care provider will use an otoscope to examine your ear canal and eardrum, checking for blockages, infection, or perforations. Simple tuning fork tests can also offer initial bedside clues. The most comprehensive diagnostic part is the audiological evaluation, performed by an audiologist. This is where we truly map out your hearing. It includes pure tone audiometry, which measures the softest sounds you can hear at various pitches and intensities in each ear, plotted on an audiogram. This is crucial for determining the type, degree, and specific configuration of your hearing loss. Next is speech audiometry, assessing your ability to hear and understand speech, including how clearly you can understand speech when it's loud enough. Finally, tympanometry measures eardrum movement and middle ear pressure, helping detect issues like fluid behind the eardrum or problems with the middle ear bones. Beyond the core audiological tests, specialized tests may be used. Otoacoustic emissions, or OAEs, test the function of the outer hair cells in the cochlea by measuring tiny sounds produced by the inner ear itself. If OAEs are absent, it suggests inner ear damage. Auditory brainstem response, or ABR, measures electrical activity in the auditory nerve and brainstem in response to sound. This is particularly useful for infants, young children, or to rule out a tumor on the auditory nerve. If needed, doctors may also order blood tests to check for underlying systemic conditions, or imaging studies like an MRI for suspected tumors or a CT scan for detailed visualization of bone structures in the ear. Treatment for hearing loss is highly individualized and depends on the underlying cause, type, and severity. We'll start with medical interventions, which are primarily for conductive hearing loss or specific SNHL cases. The simplest and often immediately effective treatment for wax-induced hearing loss is earwax removal. For medications, antibiotics or antifungals are used for ear infections that cause temporary conductive hearing loss. Corticosteroids are the primary medical treatment for sudden sensorineural hearing loss, SSNHL, working by reducing inflammation. Timely treatment, ideally within 2 weeks of onset, is crucial for the best chance of hearing recovery. Other medications include diuretics for Meniere's, immunosuppressants for AIED, and decongestants for eustachian tube dysfunction. On the surgical side, common procedures include myringotomy and tubes for recurrent middle ear infections, tympanoplasty to repair a perforated eardrum, and ossiculoplasty to repair or replace the tiny bones in the middle ear. Stapedectomy is a specific surgery to treat otosclerosis, and of course, tumor removal if a growth like an acoustic neuroma or cholesteatoma is causing hearing loss. Moving to hearing devices, the primary solution for permanent sensorineural hearing loss is hearing aids. These are electronic devices that amplify sound, making it louder and clearer. The professional to see for hearing aids is primarily an audiologist. They conduct the comprehensive evaluation, precisely determine your hearing needs, select and custom fit the appropriate hearing aid style, whether behind the ear, receiver in canal, in the ear, or even invisible in canal, program them to your specific hearing loss, and provide essential follow-up care and adjustments. Modern hearing aids offer advanced features like noise reduction and Bluetooth connectivity. It's also important to note that over-the-counter, OTC, hearing aids are now available for adults with perceived mild to moderate hearing loss, allowing direct purchase. However, they are not appropriate for children, individuals with severe or profound hearing loss, sudden hearing loss, or asymmetrical hearing differences. For those with severe to profound SNHL where hearing aids offer little benefit, cochlear implants are a transformative option. These devices bypass damaged inner ear parts to directly stimulate the auditory nerve with electrical signals. They consist of an external sound processor and an internal component surgically placed under the skin. An otolaryngologist, often a neurotologist, performs the surgical implantation, while an audiologist programs the device and provides extensive auditory rehabilitation to help the brain interpret the new electrical signals. Bone-anchored hearing systems, or BAHS, transmit sound vibrations directly to the inner ear through the skull bone, bypassing the outer and middle ear. They're suitable for conductive hearing loss, mixed hearing loss, or single-sided deafness. And in very rare, highly specialized cases, auditory brainstem implants, ABI, are an option for individuals who cannot benefit from cochlear implants due to a damaged or absent auditory nerve. Beyond primary hearing devices, assistive listening devices, or ALDs, and other technologies can significantly improve communication in specific situations. These devices work alongside or instead of hearing aids and include things like FM systems or remote microphones for noisy environments, amplified telephones, and captioning services for calls. Equally important are rehabilitation and support services. Auditory rehabilitation is therapy to help individuals adjust to and make the most of their hearing devices, improving listening skills and learning effective communication strategies. If tinnitus is present, management strategies include sound therapy, counseling, and specialized therapies like cognitive behavioral therapy. Learning effective communication strategies like lip reading and asking for clarification is also vital. For associated balance issues, vestibular rehabilitation can help, and connecting with others in support groups can provide valuable emotional support and practical advice. While medical intervention is crucial, individuals can actively engage in lifestyle practices to support hearing health and manage symptoms. These won't cure permanent loss, but they can protect existing hearing and significantly improve overall well-being. Noise protection is the most crucial preventive measure. Always use earplugs, earmuffs, or custom hearing protection when exposed to sounds above 85 decibels, like at concerts or with power tools. Also, remember to reduce personal listening device volume and take quiet breaks. A healthy diet and nutrition support overall health, which in turn supports auditory health. Emphasize antioxidants, omega-3 fatty acids, and key minerals like magnesium, zinc, and potassium, which are vital for inner ear function. Don't forget folate and B12, and ensure good hydration for blood flow to the inner ear. Continuing with proactive steps for a holistic approach, regular exercise is key. Cardiovascular exercise improves overall blood circulation, including to the delicate inner ear structures, ensuring nutrient and oxygen delivery. It also helps manage chronic conditions like hypertension and diabetes that can compromise inner ear health. Yoga and meditation, while not a direct cure, can significantly reduce stress and anxiety, which are common exacerbators of tinnitus. They can also potentially improve blood flow to the head and neck and help manage tinnitus by fostering relaxation. It's crucial to manage chronic health conditions like diabetes and high blood pressure, as they can significantly impact inner ear health. And, of course, avoid smoking and excessive alcohol, as these habits compromise blood flow and nerve function in the inner ear, accelerating hearing loss and exacerbating tinnitus. Finally, auditory training and brain stimulation strategies focus on improving the brain's ability to process and interpret sound, which is especially beneficial for people with some hearing loss. This includes structured listening exercises and engaging in mentally stimulating activities to enhance cognitive function and neuroplasticity. Also, practice active listening by consciously engaging with sounds to fine-tune your brain's auditory perception. Knowing which healthcare professional to see is crucial for effective management. Your primary care provider, PCP, is often your first stop for initial assessment, earwax removal, and referrals. An audiologist is the primary professional for diagnosis, evaluation, and non-medical management of hearing loss and balance disorders. They conduct comprehensive hearing tests, fit and dispense hearing aids, offer counseling, and identify when a medical referral is needed. For most general concerns about gradual hearing loss or difficulty understanding speech, starting with an audiologist is highly recommended. An otolaryngologist, or ENT doctor, is a medical doctor specializing in ear, nose, and throat conditions. They diagnose and treat medical and surgical causes of hearing loss, prescribe medications, and perform ear surgeries. You should see an ENT immediately for sudden hearing loss, ear pain, discharge, or severe dizziness. For very complex cases, you might be referred to a neurologist or otologist, an ENT with additional specialized training. In many cases, an effective approach to managing hearing loss involves collaboration between an audiologist and an ENT. In conclusion, hearing loss is a complex and multifaceted condition that can significantly impact an individual's life. From medication-induced damage to age-related decline, noise exposure, and various medical conditions, understanding its diverse causes and progression is the first step toward effective management. While some forms of hearing loss are treatable with medication or surgery, permanent sensorineural hearing loss often requires the use of advanced hearing devices like hearing aids or cochlear implants, expertly managed by audiologists. Beyond direct medical interventions, a holistic approach that incorporates proactive lifestyle choices, such as noise protection, healthy nutrition, regular exercise, and stress-reducing practices, can play a vital role in preserving existing hearing, mitigating symptoms like tinnitus, and improving overall well-being. Ultimately, early detection is paramount. Prompt consultation with the appropriate healthcare professional, whether your primary care provider, an audiologist, or an ENT specialist, for a comprehensive evaluation is key. With an accurate diagnosis and a tailored management plan, individuals can navigate the challenges of hearing loss, enhance their communication abilities, and maintain a high quality of life. Remember, understanding and proactive care are your strongest allies in preserving this vital sense.